Let's talk about the laparoscopic sleeve gastrectomy procedure. So what it is essentially is making the stomach into a smaller structure. So this diagram here shows a typical stomach. Of course, it's a little smaller to size. This is where the esophagus comes through that brings our food from our mouth into the stomach. And then this part is the majority of the stomach, and then that empties here into the small intestine. For a sleeve gastrectomy procedure, while the patient is asleep, I place a measuring device that actually goes into the stomach from the esophagus over here to the small intestine. And then the stomach is actually resected, or a portion of it is removed. So this black line that we see here is the typical excision point for the sleeve. And so what happens is that, unlike a diet plan where we're trying to eat smaller portions of food and yet you're still very hungry, you now have a smaller stomach, and as that stomach fills with food, you actually feel full on smaller portions of food. Approximately anywhere from 50 to 75% of the stomach is actually removed in this procedure. So it is a permanent procedure, but there aren't very many reasons that this would require reversal. So with ghrelin being a hunger hormone, that's secreted here at the top part of the stomach. When we remove that portion of the stomach, it will actually decrease your overall hunger drive. So the sleeve gastrectomy is also a hormonal type of operation. So food after the surgery will go down the same pathway, so through the esophagus, into the stomach, and then into the small intestine. And because of this, we don't see as many nutritional deficiencies as we could with other malabsorptive procedures. This surgery being fairly straightforward and all of the surgery being performed on the stomach alone means that if you've had prior abdominal operations, it will be easier to complete. The surgery is usually able to be performed in about 30 to 45 minutes. General surgery time, as far as time asleep in the operating room, is somewhere roughly to an hour. Patients are normally able to go home the same day. Occasionally patients do spend the night in the hospital. And with the sleeve gastrectomy procedure, usually start on liquids fairly soon. So we're going to recommend that most patients after this type of operation take a multivitamin on a daily basis. But even if you did not, we probably are not going to see very many nutritional deficiencies, as the food will be absorbed through the same pathway. Patients can expect to return to work anywhere from 2 to 5 days after their operation. It's usually done with a laparoscope, which is small laparoscopic incisions, which improves the recovery time. Risk of the procedure, the greatest risk we worry about is the risk of leak. So we do have a long staple line here, and I do a leak test at the time of surgery to ensure that everything looks airtight before we leave the operating room. Other risks that could happen, or adverse events, would be risk of bleeding, infection, and of course there could be some incisional pain. Overall, the sleeve gastrectomy procedure is one of the most commonly performed operations in the United States and one of the most requested procedures that patients ask for. Come see us if you'd like more information regarding this particular procedure.